I am Dr. Ashish Krishna, working in Sunrise Hospital as senior consultant surgeon in minimal invasive department and also doing my bariatric surgery. This hospital is made for minimal invasive procedures. The OT theatres are the state of the art. They have all types of equipments including the harmonic and vessel sealing devices which aid in our operation. Hemorrhoids are the swellings in the anal canal which starts bleeding, and sometimes they also come out of the anal canal almost in the shape of grapes. So basically the patient complains of bleeding and they are rarely painful. But if it is associated along with any other problems like fissures or fistulas, then sometimes they do have pain. Mainly the symptom is painless bleeding, but if they get stuck in the anal canal or outside, then they start paining also. Apart from that, there is a long history of constipation, which itself is the cause for hemorrhoids, and a lot of people also complain of itching, discharge, and some minor complications like abdominal discomfort. See, hemorrhoids is generally caused by hard stools. So when people have hard stools, they spend more time in the bathroom and toilet and they try to push the hard stool. So pushing the hard stool causes a minor trauma in the cushions of the anal canal, which ultimately bleeds, and sometimes it causes pain also. If the pile mass or the hemorrhoids, they are not bleeding, then we generally ask the patient to control his diet. That is, they should have more fibers. Along with that, they should drink a lot of water so that they can pass normal soft stool and they don't strain. That is the conservative treatment. Sometimes some local ointments and creams are also prescribed so that they get relief from the symptoms. But if they start bleeding profusely or they start coming out of the anal canal and actually hamper in their defecation, then a surgical treatment is needed. Surgical treatment is again divided into mainly two parts. That is the open technique. Like everybody knows, the pile mass is just cut off and the bleeders are ligated. And now a relatively new procedure known as stapled hemorrhoidectomy, which is becoming more and more common because of the needs of the patient, is another technique in which the single time use gun is inserted and the bleeders as well as the pile mass is taken out to restore the continuity of the anal canal. As I was talking about, stapled hemorrhoidectomy is a relatively new procedure but with excellent results. Not only the disease is cured, but also it has other many advantages, like as it is a minimal invasive procedure, the stay in the hospital is very less. That is just 1 day. Sometimes even the patient is discharged on the same day if the patient gets operated in the morning. There is very less pain in comparative to the open procedure. The patient can return to his work almost in another 2 or 3 days in comparative to 7 days required in an open procedure. And as it is very comfortable and no incisions are placed outside, it is a boon to the patient, because a lot of patients complain they have problems regarding pain and discomfort which prolong for almost 2 to 3 weeks in open procedure. So this relatively new technique is a technique that should be offered to each and every patient who is eligible for this. Once a stapler hemorrhoidectomy is done, we provide the patient with the normal fluids when the symptoms of anesthesia have waned off. So that is after 3 or 4 hours patient can take oral diet, and we increase the amount of diet as the patient feels comfortable. We check the area after 3-4 hours. If everything is fine and the patient is feeling comfortable, we ask the patient can be discharged even in the evening also. But if the patient says he wants to stay in the evening or in the night, then patient can be discharged the next morning. See, if they are left untreated, first of all, they start bleeding. And painless bleeding is sometimes even not recognized. So ultimately the overall health of the patient suffers. This is something very common that's happening, especially in India, where people often don't know whether they are bleeding or not because they don't look at their pans. And secondly, another important thing is it has to be first of all evaluated by a proper surgeon or a physician, so that whether the patient is harboring any other tumor or any other disease which is mimicking as hemorrhoids. So evaluation is the most important part. Then if in evaluation they are just first degree or a second degree hemorrhoids, just the initial thing, then we can sometimes keep them on a conservative regime also. And if everything seems to be fine, then they continue like that. If it starts bleeding or suddenly they go and get stuck in the anal canal or outside the anal canal, then an emergency hemorrhoidectomy has to be done. Prevention again is, see, a modified diet is very much essential. A lot of fibers have to be taken. If the person is not able to increase his fibrous diet, then a supplementation by either Goel or other medication, they have to be taken. I would just like to show you the machine which we are using for stapler hemorrhoidectomy. As you can see, it is a one-time machine which is promoted by the Johnson & Johnson. As you can see, it is a long gun. It has been used, and I will just show you. This is the gun. This is the gun, single time usage gun, in which everything, the cutting part, the switching part, everything is being done. See, as you can see, this is the anvil part. Here you can see small holes where the staplers come, and this thing is the anvil which goes inside. And then what we do is, all the extra tissue, the hemorrhoidal tissue and the blood vessels, they come inside this, and we just approximate this. After approximating, all the tissue comes in between. And after that, the only thing that is to be done is just firing of the machine from this. We just fire it and wait for some time, and after that we just take this thing out and the matter is over, and the tissue gets collected over here, which is to be separated and shown to the patient and to his relatives, and after that it is sent for the biopsy. So ultimately what happens, we are not making any cuts outside. What is happening inside, this whole thing goes inside the anal canal. It is cut also, and it is ultimately what happens, the whole of the thing get fused also. So stapling as well as cutting takes place in a single procedure without cutting anything outside. And because the cutting and stapling is happening at around 3 to 4 centimeter inside the anal canal, which is not innervated in the way the outer skin is innervated, so patient has less pain and the patient's recovery is very fast.